Good afternoon, everyone. My name is Judy Blake, and I am a program coordinator for Family to Family Network here in Houston, Texas. We are having the last of our trainings for this year. So we are going to be taking a nice little, probably month break before we resume in probably January, maybe February. We're going to see what happens with everyone's schedules once we return after the holidays. We have loved putting on these trainings. They have been so helpful to so many people. And I want to just introduce, before I introduce our presenter, I wanted to introduce my amazing colleagues who are on this call. Christina Zavala, there she's waving. She is on this call with me. Could not do my job without Christina. And for those of you on this call, if English is your second language and you feel more comfortable asking your question in Spanish, please private message Christina and she'll make sure that she asks the question on your behalf. I want to introduce two other colleagues who may not be having a good hair day. That's why they're not showing their picture, and that's okay. Oh, there's Inger. She's smiling. She knows. Inger Clark runs an amazing program that is, and she welcomes you. So Inger, why don't you go ahead and put your email in the chat box. Inger does a wonderful program. We have partnered with Mass Mutual, and it's all about financial planning and planning for the future, person-centered thinking. It's based on Trajectory of the Life course. I believe that's the name of the planning, and really a great program. I also want to introduce Leslie Lawson. Many of you know Leslie. She's been with us forever. So Leslie may not be having a good hair day, which is why she doesn't want to show her face. That's okay, Leslie. So Leslie is one of our parent liaisons, parent advocate, if you will, a wealth of knowledge, been with Family to Family forever. And I really work with an incredible, wonderful group of women. Our executive director is Mary Jane Williams, and she leads us into the future. We have actually been around for 31 years. We just celebrated our 31st anniversary. So very exciting. So there are so many different questions about waivers, and I've really been focused on that when presenting these trainings. And if I can find a presenter who will present for us, believe me, I ask them. So I want to present Marina Hench. Thank you, Marina. And poor Marina, I had to switch the date like 2 times because my schedule kept changing. And so Marina and team, thank you so much for being so flexible. We'd think you were a contortionist at this point. So I appreciate it. So if you want to go ahead and share your screen, and like I said, this is being recorded and I will be sending you slides probably by tomorrow or the next day. If you could please hold your questions until after her presentation, that would be great, because we want to make sure that she gets through her material, and that way we can be assured that she does that. We will try to finish by 1 o'clock. It just depends how many questions everybody has. Please remember that this is a really safe space. No question is silly. No question is ridiculous. If you don't feel comfortable asking your question in the chat box, please private message myself or Christina, and we will be happy to ask the question on your behalf. Marina Hench, thank you so much.
All right, thanks, Judy. Thanks so much for having me.
My pleasure.
Before I get started, are you viewing the right screen?
Perfect.
Okay.
Thank you.
Very good. Well, I'm really happy to talk to you all today. And before I get started, I think, Judy, you had said in the room we have some families, we might have some nonprofit organizations.
We do. School districts, social workers, Texas Workforce Commission folks. We really have a wide variety. We're very much into community outreach, and the more we all connect, the stronger we all are.
All right, wonderful. Well, in putting this presentation together, I tried to keep it fairly high level, but I imagine that given the group that we have in the virtual room today, that there's a lot of knowledge and a lot of expertise. And so if this is too high level for you, feel free to ask questions that get into the weeds and that get into exactly what you're curious about today. I've been asked to present on the STAR+ program in Texas Medicaid. I'm the STAR+ specialist, which means I help manage the program. I'm in the Office of Policy, so we're always looking for opportunities to assess what we're doing and to improve upon it. I work a lot with the Medicaid managed care organizations that work on behalf of the Texas Health and Human Services Commission to implement the program, and those are the organizations that Medicaid members interact with regularly along with their providers. So it's also really great for me to get feedback from you who are experiencing the program day to day in your everyday lives, so that we can, take opportunities to improve the way we do things. So with that, I'll go ahead and get started. Hopefully my slides will advance because I had a challenge with this before. Doesn't look like they are. Let me try again. There we go. Okay, there we go. Judy's nodding. So in this presentation, we'll do a quick overview of Medicaid. We'll talk a little bit about member enrollment and assessment in the STAR+ program, talk about what STAR+ is as a program. Judy had mentioned that there's frequently questions about the transition from STAR Kids, which is the children's program, to STAR+, which is the adult program. So I'll touch on that really briefly, and then get into the STAR+ Home and Community-Based Services, or HCBS program, which is something that I know you all are interested in as well. We'll talk about some of the service delivery options, and then lastly, service coordination. So as you probably know, Medicaid's the jointly funded state and federal program that provides medical coverage to low-income Americans and to people who need these services. And in Texas, the Medicaid's administered by Texas Health and Human Services Commission, where I work. We contract, like I said, with Medicaid managed care organizations to establish the provider networks that serve the Medicaid population and help coordinate the delivery of services to Medicaid members. Texans can apply for Medicaid through the web, through yourtexasbenefits.com. There are local eligibility offices, 211, mail fax. We have an organization that we call the enrollment broker, which is Maximus, and they're an independent entity that facilitates all of the enrollment for Medicaid that happens in Texas. So when an application comes in, it's reviewed by Maximus. They are going to assist the applicant with selecting a STAR+ MCO. And if a person doesn't choose, then they'll be randomly assigned based on their service delivery area. STAR+, which is the program that I help manage, is a Texas Medicaid program that provides coverage to people with disabilities and to the elderly. The program really specializes in long-term services and supports, and is operated through Medicaid managed care organizations, as I mentioned. MCOs are insurance companies. but they also have additional responsibilities over and above your typical insurance company, service coordination being the primary example. So they have a team of nurses and social workers whose job it is to assess members' needs for services, to kind of be that frontline customer service, especially for higher needs individuals, and to help Medicaid members get connected with services. MCOs work on behalf of the state of Texas, so they're our proxy. And so we are always, through our contracts, trying to ensure accountability of the MCOs and make sure that they're facilitating and delivering services in the way that is expected from the state of Texas. In STAR+, we have about over now 580,000 people served in the state, which is a lot. So who gets STAR+? Like I mentioned, people with disabilities who are age 21 and older, the elderly, 65 and older. We have a program within STAR+ for women with breast or cervical cancer who are also Medicaid eligible. And everyone must be a resident of Texas and a US citizen. It gets more complicated from there. There are several different, what we call eligibility groups or kind of pathways to STAR+. A lot of people are eligible because they're getting supplemental security income or SSI, and that determination is done by the all done by the federal government. If they're eligible for SSI, they can get Medicaid. Then there's a group of who are not on SSI, but they are eligible for the STAR+ home and community-based services program because they're low income and they have a medical need. If you're in nursing home Medicaid, you're also eligible. And then there's a couple other categories such as this Social Security exclusion program that I won't get into, and then the Medicaid breast and cervical cancer program that I mentioned. So STAR+ is a coordinated blend of traditional Medicaid benefits, which is your, traditional medical health care, acute care, personal care services, so attendant care and habilitation, nursing facility, and then also primary PCP, health home services. And in addition to that, there is a program within the program, Home and Community-Based Services, or HCBS, that's like this add-on package for those who need it, with a whole suite of additional long-term services and supports that someone might need if they are nursing facility eligible, but they want to live in the community. So those are therapies, at-home nursing, kind of an extended package. And then service coordination, as I mentioned, is a key benefit of STAR+. That is a service that's furnished by the managed care organization. And folks in STAR+ get unlimited prescriptions as a benefit. I know that we get a lot of questions about the transition from STAR Kids to STAR+. STAR Kids is the Medicaid managed care program for children and young adults up to the age of 21. And so when individuals in Medicaid, in STAR Kids, reach the age of 21, they may go on to graduate, if you will, to STAR+, to the adult program. And so we have specific protocols and processes that are especially geared toward those kids with high medical needs, and the need for long-term services and supports, particularly those that are in the medically dependent children's program or MDCP, and who might be getting private duty nursing. So we track those folks a little bit more carefully and manage that transition between programs a little bit more carefully.
And Marina, just so you know, we have a great gal who is on this webinar as well, Elva Caballero, and she's with Maximus, one of the top
Oh,
dogs
perfect.
there. So, so just so you know, if there's anything you're kind of like, Elva's here to help.
That's great.
Thanks, even though you're doing great.
Well, the eligibility and enrollment piece can get really complicated. So I mostly manage the program.
Absolutely.
So it is really, yeah, it's really wonderful to have that resource because yeah, Medicaid eligibility and enrollment is a whole thing. What changes that transition from STAR Kids to STAR Plus? Individuals are no longer eligible to receive children's services. And because of that, there might be significant changes to family dynamics due to the loss of those services. So we're definitely cognizant of that. STAR Plus HCBS program becomes an option for those kids, particularly who are in MDCP and now needing the adult program. There are some individuals who might qualify for what we call the IDD waivers, intellectual and developmental disability waivers. And so for those individuals, if the waivers can't meet their needs under the cost limit, then STAR Plus will be available to them. So I'm going to dive in a little bit deeper about the STAR Plus HCBS program. As I mentioned, this is this enhanced package of benefits for those with a nursing facility level of care, but who want to live at home or in the community somewhere. STAR Plus HCBS is often kind of colloquially referred to as STAR Plus Waiver. Because once upon a time, it used to be the CBA program, community-based alternatives. CBA, it no longer exists. That program went away, and the population that was served by CBA was carved into STAR Plus. So STAR Plus HCBS is the option for those individuals who are nursing facility level of care and who need extra supports in order to live independently. There's a few access points, if you will, to HCBS. Some people will be transitioning from STAR Kids, especially MDCP. If someone is living in a nursing facility and wants to leave and live in the community, they will automatically qualify for STAR Plus HCBS as long as they have a place to land when they leave the nursing facility. You could have a STAR Plus member in the kind of general STAR Plus program that has a change in condition that suddenly means that they have more acute needs or need for nursing services. There was a car accident, they became ill. There's some kind of condition that makes them medically eligible for STAR Plus HCBS. And then there's a group who might be newly eligible because of their income and because of medical needs, but who are not SSI eligible. And they're kind of coming in from the outside of STAR Plus, if you will, and outside of Medicaid. We sometimes refer to this group as the interest list because if you don't go into a nursing facility first, then you have to sit on an interest list before you can be in STAR Plus HCBS. That's because of the Social Security Act, unfortunately.
And just so you know, Marina, one of your colleagues just joined us,
Oh,
Veronica
great.
Neville.
Yeah.
Yes, so you know.
Thanks. So when a person enters or is entering the STAR+ HCBS program, they've enrolled in the MCO. The MCO service coordinator has to do a medical necessity or level of care assessment, also called the MNLOC. So the MNLOC assessment identifies service needs of the person. That's going to be conducted by a service coordinator who's a nurse or a social worker. And based on that assessment, the managed care organization, in collaboration with the STAR+ member, will develop an individual service plan. So this is the list of all the needs of the person and how many hours they might require of each service and the frequency. And STAR+ HCBS members must sign off on that individual service plan. The ISP is required to receive services in the program, in the HCBS program. So here's a partial list. This is a lot of the services that are offered through STAR+ HCBS, but by no means all of them. These are the long-term services and supports that are in addition to the more traditional Medicaid benefits, like medical care. So these are the services that are going to allow someone to remain in the community. And STAR+ members can choose how they would like some of these LTSS services to be delivered. We have a few options. The primary option is through a provider agency, through for example, if you're receiving personal attendant care, you might be likely to utilize a home health agency. There's something called the service responsibility option, where the person would manage the day-to-day activities while the provider would manage the business activities. And then we have a really popular option called consumer-directed services, in which the STAR+ member can manage their own attendant and the day-to-day kind of activities of their caregiver, while financial management providers take care of some of those business needs, accounting, payroll, that kind of thing. And then lastly, I'll talk a little bit about service coordination. This is defined as a specialized care management service performed by the managed care organization that includes identifying needs, including physical health needs, mental health, long-term services and supports. The service coordinator, like I mentioned, is going to develop that service plan with the member that identifies all of their needs and what's going to be delivered through the program. The service coordinator is there to assist in ensuring timely access to services, making sure that the members have a choice of providers to go to. They're going to help triage specific situations or unique needs of the member, and they're going to be helping to coordinate services with other providers, with the family, with Medicare, if the person is dually eligible for both Medicaid and Medicare, help coordinate with other insurance if the person has other coverage. And through our contracts with managed care organizations, the commission, works with the MCO to stratify individuals being served in the program through service coordination by level. So level 1 is your highest needs person. they're going to have more kind of, the MCO will have more strict guidelines as to outreach requirements to the person. Those are individuals who are in STAR+ HCBS, who are nursing facility, or who have a severe mental illness. So the MCO has to outreach to those folks a little bit more frequently. They have to have face-to-face contact with the person. Someone who's grouped into level 2, they also have to have a single identified service coordinator. They're probably receiving community LTSS, like PASS services or habilitation. They might be in the Medicaid breast and cervical cancer program. And then the level 3 members is basically anyone in the STAR+ program, and they can request a service coordinator at any time. So that was the very quick, high-level overview of STAR+. I haven't been monitoring the chat, but I imagine that there's probably questions there. And so Judy, I'll—
Lots of them.
Yes, I'm
Hope
sure.
you had your Wheaties this morning, Marina.
Yeah.
So if you want to stop sharing your screen, but no, this was great because people have asked a lot of questions. So let me go ahead and
Judy, may I intercept for a second?
Sure.
Can I go ahead and explain to those who are attending our role for Marinas, just to make sure that
Sure.
there is, people understand who we are as Maximus.
Great.
So,
and then also put your information in the chat box.
yes.
Your contact information.
Okay. So as Marina stated, we are Maximus. We are the enrollment broker for Medicaid, and our role is to contact our clients who are eligible to be under the STAR+ program. And what we will do is we will provide you education as to how your Medicaid is going to work in that Medicaid managed care program called STAR+. We will help you understand the different health plans available to you in your family or your child, your adult child, or yourself. And we will help you select the health plan and the primary care provider. Now, if you have a person that has multiple doctors, maybe it's just not the primary care provider because maybe they have a disability, then we will look at where those providers are, what plan are they working with. So at the end, you can make the best decision for yourself or for your loved one as to which plan is the best one. So we do not have anything to do with the eligibility part. That starts with HHSC, who will determine based on your application whether you are going to fall under qualify for STAR+, or sometimes there is also the STAR program and the STAR Kids, but STAR Kids is for children under the age of 21. So by the time we get the file for the client, we already know that you are in which plan, in which program, in this case, STAR+. We will make phone calls. We have 2 long-term services and support staff that will make phone calls to help you with the education, understand STAR+, understand the health plans, help you make that decision when it comes to the best plan and best primary care provider for your families. So that is our role. Once the person selects that health plan, the plan will take effect anywhere between 15 and 45 days. And then once that plan becomes effective, any questions that we have from clients, specific questions, we always have to refer you back to the plan because now you are a member of that plan who's overlooking your care. And so if it's questions that we can answer, we definitely will do that, and we want to do that or make the appropriate referrals. But once that plan is effective, we will always refer you back to the plan because a lot of the times are eligibility questions regarding to services that the person is looking for. So I just kind of wanted to clarify, our role when it comes to the STAR+ program.
No, that's fabulous. And I'm so glad that you're on this call. So just to kind of sum it up, you help people become enrolled in Medicaid, correct?
No.
No.
So the client will complete the application with Medicaid office. You
Right.
submit your application for Medicaid, and based on that application, based on even the assessment or the needs, that client, so
You
let me
help
kind of
them,
go,
you
let me-
educate them about the different plans?
let me kind of go back a little to
Okay.
make a little bit more sense. So Medicaid clients are divided into plans based on their eligibility. So we have the STAR program, we have, which are mainly pregnant women and children. We have the STAR kids that are children on Medicaid under the age of 21. They must be receiving either SSI or be on a waiver program. We have the STAR+ program, which is people with disabilities and the age and disabled over the age of 21. And then we also have STAR Health, which is children in the in foster care. So depending on where you are, how you are eligible, in that application starts with Medicaid office, we get it, I already say this client is eligible for Medicaid, and based on probably even the interview with the client or possible assessment from the client, this client belongs in the STAR+ program. So now we get your file of the client, and we are going to call you and say, okay, so I see that you're in the STAR+ program, and so let's help you select the health plan and look at your providers, or if they only have a primary care provider, let's help you select a primary care provider. Now, having said that, there is a different population. We also have the population that has Medicare and Medicaid. And so if they have, and we call those dual eligibles. If they're dual eligibles because they have both, then Medicare is really their primary insurance, their hospitals, their doctors, their prescriptions. We are going to help them select a health plan only for the long-term services and support that they may need. So we are not going to say, what about the doctors? Now, if that person is receiving home health, then obviously we're going to say, okay, well, who's your home health provider? Let's see what plan that home health provider is working with.
Okay.
So that's where we come in.
Okay.
I hope that makes sense. If not, I'll
Yeah,
be glad
it's a lot. It's hard to wrap ourselves around this. And Elva, a couple of people have asked for your contact information. So let me go ahead and get to the questions. I'm so glad that you shared that with us. Thank you, Elva. Truly appreciate it. So if you have to leave, hopefully not now, but if you did, please make sure that you complete the survey. Christina has been putting in that link. First question, why does private duty nursing end after age 20 if nothing else about the person changes? Why would a person need private duty nursing one day but not the next? Marina, that's for you. And Marina's thinking, that's a good question. I don't know why.
Yeah, well, it's kind of a complicated question. I mean,
it's like my son has
refer to-
autism. It's not like it changed when he turned 26, you know?
No, yeah, well, we call it private duty nursing in STAR Kids.
Mhm.
It's a benefit of STAR Kids, and the state must provide private duty nursing in large part due to EPSDT, early periodic screening diagnostic testing.
Mhm.
It's a required benefit of STAR Kids. When a person leaves STAR Kids, there may be services that are no longer available to them because they are only because those services are only eligible in STAR Kids. But if a person has a nursing need for at-home nursing,
Right.
that would allow them to live in the community rather than a nursing facility.
Exactly.
They would receive at-home nursing through the STAR+ program.
Okay, because I think this parent is not encountering that. So what should they do? what should they do if they were receiving private duty nursing when the kid was 20 and now the child or adult is now 21 and being told nope? And that's not the first time I've heard that. Unfortunately, I've heard that a lot as they transition. So
the
what should they do?
STAR+Plus MCO.
Mm-hmm.
They can always appeal. I'm sorry to interrupt. But
Sure, they can what?
I said they can always appeal that decision, but yes, that is something that they would have to contact their health plan.
Their managed care organization. Okay. Okay. So someone who knows the HHS long-term service and supports waiver program document, it actually says on page 17 that STAR+ HCBS, there's no limit to nursing based on need. And it just seems to kind of conflict. So it's kind of frustrating because I think that there's policies, Marina, that you and your team review, approve, analyze, but then the execution of it isn't quite followed through. So I think you listed an email that people could reach out to you on your last slide, correct?
Yeah. Yeah, I want to be clear that when a person enters STAR+, they're going to get a brand new assessment.
Okay.
That is different from the STAR Kids assessment. They may or may not be in a new health plan. And the coverage criteria in STAR+ is different than in STAR Kids. And so the new MCO in the new program is going to make a new determination. And if the family disagrees with that determination, then they should appeal through the MCO. There are limits in STAR+ on services because there is a cost cap.
And that's what's
part of our, yes. And that's part of our contract with the federal government. So, so services cannot exceed that cost ceiling, which is based on or tied to nursing facility level of care. And so there could be a situation in which hours or services may be adjusted either because of the new assessment by the new MCO, the new service coordinator has made a different determination than in the STAR Kids plan, or because the person is bumping up against that cost ceiling. Now, there are, we do have a process for making exceptions to the cost ceiling based on medical need.
Right.
And so the person could be eligible for what we call the general revenue process, or it's an exception process to exceed the cost cap. And that's a whole whole process. But I would say if you're encountering a situation in which the service plan that the MCO developed is not meeting your needs, yes, go ahead and do appeal that to the MCO.
Okay. Because how do you put a price tag on your loved one? It's really hard, and it's not your fault, Marina. You're doing a great job. It's that, how do you put a price tag? You know, nothing changed because the person turned 21. And it's really challenging. It's really challenging. And I certainly don't mean to bombard you with all these questions, but they're really great questions. So I appreciate you answering them. I truly do. So
hey, this is Veronica. I just wanted to chime in.
Hi, Veronica.
Hey, in addition to what Marina said, or just clarify that when she said that the coverage criteria is different, the private duty nursing, and I think this is implied in the question, but just want to make sure it's clear, is a benefit only for youth. So that's just something to keep straight. So that's why, you know, we have nursing, like Marina said, in STAR+. It's just an entirely different benefit under the for Medicaid.
Right.
That was
And I appreciate you saying that. And I think that the question families would have is, you know, my loved one, their needs haven't changed when they turn 21, yet sadly, what is offered has changed. And what are parents supposed to do? It's really, really hard. Really, really hard. And I know you can't answer that. I realize that. No worries. So regarding STAR Kids, when you have STAR Kids and you have personal attendant services, you know about Community First Choice? Yeah. Okay.
Yes.
So there's sort of an issue where hours are approved. Okay, I'm trying to understand the question because there seems to be a little bit of gap in services. STAR Kids should continue personal attendant services until the local authority like Harris Center, Texana can get the Community First Choice hours approved, or the STAR+ HCBS waiver nursing or attendant care. Is that correct? Because sometimes what happens is the local authority is a little bit backed up and they haven't been assigned a CFC coordinator. So would the pass hours still continue? Or is the parent just having to wait until they get their CFC coordinator and it's been approved? Do you know if that's how that works?
Yeah, I'm sorry. I guess I'm not really clear on what the scenario is.
Are
we talking about it?
Yeah.
You
Go
want me
ahead,
to
Leslie.
explain it? Okay. So what happens is somebody's on STAR Kids and they're receiving personal care services. The transition for the medical part to STAR+ at 21 works beautifully. They get it as soon as they turn 21, but our local authority, like the Harris Center, says they're not able to even assess their level of need for attendant care services or whatever PASS-HAB services, whatever you want to call them, until that person actually turns 21, and it could take up to 3 months for that to happen. And so then the person that has turned 21 is without any attendant care or personal care services for 3 months. But someone at the Harris Center says what should happen is they should be able to keep their personal care services through Medicaid until the local authority, the Harris Center or Texana, has a chance to do their assessment and get them on attendant care services or whatever assessment has to be done for home and community-based services. So that could cause a crisis for the family if they were having people come in to help them every day with the individual, but then for 3 months, they can't do without services for 3 months while the local authority or whoever does their assessments for that care.
And it also takes time to get them assigned a service coordinator for Community First Choice. So it's almost like you need to allow maybe 4 to 6 months before STAR Kids ends to allow that transition to happen when the loved one turns 21. Do you know if they're able to keep those personal attendant service hours through STAR Kids until they're approved for?
It sounds like in this scenario
Mm-hmm.
that the person might be getting their attendant care through one of the IDD waivers.
I
No,
Leslie?
they were getting personal care services through their STAR Kids Medicaid,
Right.
It is
not
my-
through a
it is-
waiver. They're not on the waiver. They're still on a waiting list for all the waivers.
It is my understanding, and I had shared this with Judy, that
Right.
for us, we contact clients 2 months prior to their 21st birthday. And so we will provide all of the education about transitioning over from STAR Kids to STAR+Plus. We
Right.
will assist them selecting that health plan, only the plan, so that they can contact their service coordinator with STAR Kids to help them look into what providers that may be available to them. It is my understanding that none of the services will end until the next assessment is completed.
Oh, that's interesting because that's not what seems to be happening.
Right.
And yes, the STAR Kids coordinator did do everything in a timely manner. And like I said, transition from STAR Kids Medicaid to STAR+Plus Medicaid. Not any of the long-term care services went beautifully. It was the personal care services to attend it. You know, they all call it something different. They call it personal care services. They call it PASS-HAB. They call it attendant care, depending on different waivers and different programs. So that's the part where the person was without any of their
Right.
attendant care or whatever you want to call it, personal care services for 3 months while they're still waiting for new
For the local
assessments to be
authority
done.
to do their part. Right.
But it sounds like Elva's saying that should not happen.
Right. And thank you, Alva. Thank you. Then Leslie, we need to look more into that. Okay.
Okay.
And we'll discuss that. Yeah, thank you. You mentioned, Marina, if parents have a problem with their MCO, who should they contact? So do you appeal? I mean, I don't know how much MCO people are going to want to give their supervisor's name, knowing that you know, who do they contact if they're having a problem with their managed care organization?
Are you talking about a problem, such a complaint, or they are looking for services or
Just
disagreeing?
in general, for anything.
Yeah, when they get their health plan card, they will get an ID card from the health plan. There is a customer service number that they can contact.
Okay.
Mhm.
Okay.
Yeah, so there's a couple of different routes that someone can take, and I can follow up after this
Mhm.
meeting and get this to you in writing as well. But
That would be great. If you could, and then I'll
Yeah.
include it, what to do if you're having challenges. That would be great. Thank you, Marina. And I'll send that with the
Yeah.
recording and the slides. I appreciate it. Someone asked, how low income does one have to be to qualify?
the answer, as usual with Medicaid, is it depends.
Yes, that's a good answer. Thank you, Marina.
Yeah. so it does depend on
Household
the-
income.
what they call the eligibility criteria. So if you're coming through, if you're eligible because you receive SSI,
Mhm.
then it's the SSI criteria, which, don't quote me on this, but I think it's something like $24,000 a year or something like that. It's
Right.
it's a percentage of federal poverty level.
Yeah.
And then if you're qualifying because apart from SSI, because you have a medical need, there's other income criteria that are set by the state of Texas. So it really does depend.
Okay. And I know,
Yeah.
again, that's a very complicated, and when they start with the
Mhm.
percentages, it's hard.
But one of
Um,
the things that we tell clients, Judy, and I'm sure that you do too, is because, like Marina says, that is very, there could be so many factors, especially
Sure.
when it comes to financial, if you're self-employed in
Mhm.
contract or whatever. And so we always tell our clients, you need to apply. And so at least you will know whether you qualify, or if you don't qualify, you should get a letter that, did not qualify for the program. So it's always best to just apply for Medicaid.
Yes. Yes, absolutely. Another question is, Are the personal attendant service hours under the STAR+ waiver, the HCBS waiver, paid through Community First Choice Federal?
Again, it depends.
It depends, okay.
Yeah, so, I mean, Community First Choice is really more of almost like an accounting mechanism that the
Mhm.
state has with the federal government.
Sure.
It's really just a mechanism to expand access to community attendant services to those with institutional level of care. And so, yes, if you're receiving services in STAR+ HCBS, it's very likely that that will be funded by the Community First Choice option.
Okay. ABA therapy. Do you know what ABA?
I don't.
That's okay. It's applied behavioral analysis, and
Okay.
it's evidence-based research that shows that people, individuals with autism, have a quite good success rate when they get ABA therapy. So, and Elva, I don't know if you know the answer to this question.
Yeah, I was in a committee that ABA was being discussed. And so really the challenges are that ABA is a very expensive therapy.
Yes.
And so for that reason, there is a challenge of recruiting providers to Medicaid because they're going to be paid the Medicaid fee. And
Mhm.
so it's definitely out there, is being discussed as ways to recruit providers, but that is going to be the challenge because ABA is so expensive.
Okay. So Jennifer, more to follow on that one.
I think, Judy, I think what we'd like to do is take that question back and get you an answer in writing, because
Sure.
I know that there have been changes to
Right.
Medicaid recently.
Yeah, I heard that as well. And Medicaid was, ABA therapy was supposed to be covered under Medicaid, but then there wasn't money for it in the budget.
As of February, that's
Yeah.
what I have heard.
And then the reimbursement rate supposedly went up, and yeah, that'd be great, Marina. Thank you.
Yeah, so I want to get you an exact
Sure. No,
status
thank you.
update.
I appreciate it. Is there a waiting list for the STAR+ HCBS waiver?
For certain individuals, yes. For
Okay.
others, no. So if you're in a nursing facility, if you're already in STAR+ and you're in a nursing facility, you can qualify immediately for HCBS.
Okay.
If you're transitioning from MDCP, you're probably going straight to STAR+ HCBS.
Okay.
If you if you were not in Medicaid previously, developed a debilitating illness that forced you to spend all your money, and then you've become medically eligible for HCBS, then you might be on what we call the interest list. So it kind of depends on what route the person is entering. If that makes sense.
Yes.
And Judy, that interest list is like the others. They don't have to be on Medicaid while they are on the interest list.
Exactly. Thank you. Good point, Elva. Thank you. My mom has United Healthcare for her dual complete Medicare and Medicaid, but she qualifies for HCBS. How do we get her into HCBS in STAR+ and still keep United Healthcare? Boy, Marina, we're really testing you here.
So, okay, go ahead.
Oh yeah, well, I guess I'm trying to understand the situation a little better. So would the person be willing to kind of repeat the question in their own words?
Elva, do you know what Mercedes is trying to say?
I think I understand what she's trying to say. So if you are a dual eligible, you have Medicare and Medicaid, that person should already be in the STAR+ program. And We do look at if Medicare, if they have United Health through Medicare, they do not have to change their health plan through with Medicare. With the Medicaid side, they can choose United Health as well as their plan for the long-term services and support. If I understand the question correctly, they should already be on a plan, and they can change the Medicaid plan, and we can help them with that. We will not be able to help with the Medicare side, but yes, as long as if they have Medicare, excuse me, if they have United Health through Medicare, they can keep their plan.
Okay.
Which is, I believe, what they're wanting to change, to keep.
And Mercedes, if that still doesn't add up for you and doesn't make sense, please reach out to Elva. And if you still are having challenges, reach out to me and we will get you that answer.
Thank you very much.
Anytime, Mercedes. For the person who is named Coleman, for clarification, is a child diagnosed with autism only eligible for these Medicaid benefits / services only if they meet low income standards or receive SSI? Can this child receive these services by only having the diagnosis?
No.
Correct.
So
Yeah.
they have to apply. The first thing that they need to do is apply for Medicaid if they're not already on Medicaid. If the child has autism, but they do not have but they're not receiving SSI, or they're not on a waiver program, they're going to go into the STAR program. But if he has autism and receiving at least SSI or on a waiver program, then they will go into the STAR Kids program.
Okay.
But in order to be in STAR Kids, they must have a disability, they must be receiving SSI or be on a waiver program. Otherwise, they could be on Medicaid, they're just going to be on the STAR program.
Oh, is that confusing, Elva? You could do this in your sleep, huh? If a child is on MDCP, knowing it ends at age 21, should they get on the list for other waivers or just wait to be transferred to HCBS?
Well, my answer to that would be that they need to be on all of the interest lists, waiting list. Now, if she's referring to STAR+, yes, we will do the transition because this child is probably also on the STAR Kids program. So then we're talking about the transition from STAR Kids to STAR+. But in my opinion, yes, they should be on all of the waiting list for the waiver programs.
So definitely sign up. And for
Because you
those of
never
you
know
who-
what you may need.
Exactly. That's exactly right. And a lot of times you can just Google, how do I sign up for XX waiver in Texas? And it'll tell you what you need to do. I do that all the time. Marina, do you have the current rate sheets? Because one parent was trying to find rate sheets for the different waivers.
Yeah, pardon me. Yeah, I saw that question that you emailed, and the rate sheets are all there available on the provider finance website, which was the link that you shared. So I do want to clarify that in STAR+, HHSC does not set rates.
Oh, okay.
The managed care organization negotiates provider reimbursement rates with their contracted providers. HHSC still develops rates for all of the fee-for-service waiver programs, and is still developing rates for the old, as they would have in the old CBA. Those are for
And can you
STAR+.
define what CBA is?
Oh, sorry, community-based alternatives, which was
Thank
the
you.
old program.
Right.
Before that group got carved into STAR+. And so the MCOs will use those rate sheets more as a guide
Mhm.
than anything else, as a benchmark, as a suggestion in the rates that they establish with their provider networks.
But I will say this, I don't think an MCO is going to go above the rate sheets. They're not going to pay more. I would
Sometimes
think.
they do.
Really? Okay.
Mhm.
I'm thrilled because we haven't seen that.
Mhm.
That's as high as they'll go. That's what we have found in the families that contact us, but I'm really glad to hear that. Where can we find those CBA rate sheets? I mean, not the CBA, but just the rate sheets in general. Where was that again? I'm sorry.
Yeah, I'll send the link out.
Okay.
It's it's like a website within the HHSD website that's a
Got
little
it.
hard to navigate to. So
No
I'll send
worries. I appreciate it. Thank you. Is the assessment done in the home when they're assessing?
yes.
It is. Okay. And where does someone apply for enrollment in the first place? So Elva or Marina, would that be they go online and apply for Medicaid?
I think they need to be a little bit more specific. Are they talking about applying for Medicaid
Mhm.
or enrolling in a health plan? If the question is enrolling with a health plan, that happens automatically because we will be calling them, or they will also receive our packet to help them select a health plan and primary care provider. If they are talking about enrolling on Medicaid, then they need to apply for Medicaid by going online to your Texas Medicaid.
Yep.
Or going to the local office.
HHSC office?
Yes.
And I would recommend going online. It's a lot easier. I hope that answered your question, Cindy. When a person gets SSI and Medicaid, excuse me, through the managed care organization and is still on the waiting list for other waivers, that would be my son, should the managed care organization coordinator tell the person and evaluate the person for STAR+ waiver?
Yeah, I think it's up to the individual and the family. Certainly someone who's on the waiting list for one of the waivers could get services immediately in STAR+ if they qualify.
Right.
Long-term
And
services and supports.
right. And I think that sometimes parents, they just don't know what they don't know. And I think it's really hard. And it's kind of like what we were talking about earlier, that transition and who's going to tell them about the STAR+ waiver. Is it the MC? But it is the MCO coordinators, for lack of a better word, responsibility.
Yeah, I mean, what's like in an ideal world, what's supposed to happen is when someone enrolls in STAR+, they're going to get a health risk assessment, which is usually done over the phone.
Mhm.
And in that health needs assessment, excuse me, and in that needs assessment, the MCO is going to identify if they have medical needs, if they have functional needs, if they need attendant care, if they need mental health, or
Right.
they need nursing,
Mhm.
and make the person aware of their options.
Yeah.
So we don't really want to be in a situation where the families have to ask.
Right. Right.
Yeah.
And I'm just not sure that somebody's MCO representative, it's hard, there's a lot of information, is always going to say to the family, hey, are you aware of this? Because again, we don't see that happening sometimes, and it's just frustrating. If a young person receives the yes waiver, excuse me, if a young person receives the waiver, Mercedes, you might need to clarify here. Yes, for mental illness and ends at age 19, do they then get transitioned to HCBS?